Good morning, Dr. Kavanagh.
Good morning, Scott.
Glad to have you, as always, as we try to keep up with the coronavirus, even though everybody keeps saying and we keep feeling like, boy, we're getting closer, we're getting closer, we're getting closer by the minute, but there's still a lot of news to keep up with. And the one that caught my eye as I was coming into work this morning, or as I was looking over things this morning, is the fact that Italy, which was one of the first and hardest hit, particularly of the European nations, when this first came around about a year ago, is now closed down again.
That's correct. They've gotten hit extremely hard again, and cases are rising. Much, much worse than the first wave. Not quite as bad as what they saw over Thanksgiving and Christmas, but almost there and still going up. And so we're not out of the woods yet, and it makes me very nervous that everybody is celebrating. The analogy that I hear, and I think it is very good, it's kind of like with these vaccines, catching a Hail Mary pass, running down towards the end zone, and then spiking the ball at the 5-yard line. We're almost there. We're just weeks away, but we really shouldn't be letting up at this point.
Is the Italy situation, is that because of some of these variants that we're starting to hear people worrying about?
It may well be. And the variants are of concern because they're spreading faster and they are also causing increase in the severity of the cases. And deaths are going to go up in people who aren't vaccinated. The silver lining is it looks like all of the vaccines are effective in preventing hospitalizations and deaths with all of these variants. That's very good news. The bad news is we don't have nearly enough people vaccinated. And COVID-19 does affect the young. I need to drive that point home. Yes, they're less likely to die, but you're hearing more and more about the long hauler syndromes. Lexington Herald Leader had a very good article which ran last week that depicted a young female, a young lady who developed COVID-19, severe problems, and that lasting problems, especially with brain fog and arthritis and other types of ailments and complaints, are being seen in almost a quarter of people who are asymptomatic or mildly symptomatic many months down the line. And when you say many months, it doesn't mean it'll just last many months. No, the studies just followed people for that length of time. These symptoms appear to be persistent. They may go away over a long period of time, but the take-home message is this also can affect the young. And so that brings us into spring break, which is an extremely bad idea and unfortunately travels up. And Florida is a place that has a lot of the variants, and spring break has the potential of spreading these variants throughout the nation. And that's something we do not want to have happen.
And we had one of our regular guests who was on earlier this morning went to Florida following his daughter's college team at a basketball tournament. He said the plane was packed, both going and coming back.
Yes, and that's not good. And most of the young people are not vaccinated. They can still pick up the virus. They can carry it back home, especially these variants. On top of that, they're still susceptible to long hauler syndrome, which unfortunately is common. And goodness, they need to get a vaccine too before they start undertaking travel. Because what we don't want to have happen is this virus mutate into something that can evade the vaccine. And if you look at New York has their own variant, and the New York cases have not fallen to nearly the level of what you'd like to see. They've plateaued at a very high level, and they feel that this is due to their homegrown variant, which right now is about 40% of the cases, and it does have some of the mutations that can evade the vaccine. So the New York plateau is at about half the level of the peak over Christmas. And so it is still way too high. And in New York City, from what I've heard, the cases are starting to tick up. Now, that doesn't mean you panic. That doesn't mean you say, oh, what am I going to do? Well, it's simple. You follow public health advice and you get the first vaccine that you can because the vaccines are effective. But let's not spike the ball at the 5-yard line right as we're crossing over to get a touchdown. Very, very important to do.
On some of the material that you sent me this morning, you talk about Russian intelligence using fake news sites to spread misinformation.
Well, yes, and this is regarding the vaccines. We've seen this before of really organized misinformation campaigns on our website. Some of these I've traced back and even asked the gentleman if he was a handler. And it had to do with the severity of the coronavirus. And the misinformation's tremendous, but at least for the vaccine, they have this nailed down very well. And it does look like they are promoting their vaccine and trying to hype up the complications of other vaccines, and that's going to cause people not to want to get vaccinated. In Colorado, there's a tremendous percentage of people who do not want to get the vaccine. For example, 88% of the Democrats want to get it, but unfortunately only 29% of Republicans. Again, there's still a big belief that this is not a severe disease or that the disease cannot kill people, or God knows what they're thinking about the vaccine. I mean, I hear all sorts of crazy things from microchips to mind control or whatever. Well, it doesn't do any of that. What it does is prevent you from dying or getting severely sick or long-term complications from COVID. So again, get the vaccine. This should be good news. We just need to get the public to embrace these strategies and the treatments that are available.
Dr. Kevin Kavanagh is the founder of HealthWatch USA. How do we find HealthWatch?
Go to healthwatchusa.org. We have a lot of information there about COVID-19, along with a number of articles which we have written regarding public health advisements, some that we think are good, some we think need to be a lot stronger. But the overall message is we're almost out of this, but almost doesn't mean we're out of this. Let's just hang on for a few more weeks.
Dr. Kevin Kavanagh will talk to you again on Wednesday.
Thank you now, sir.